Welcome back to the Rotary Sunday Series, and we are very happy to see that this is gaining so much momentum and so much of information that you're seeking. And we will take this opportunity to bring to you the different Rotary heroes and legends as we trace their journey on the episode. Let's get started. This time we have a guest who believes in work more than title. I'm speaking about none other than Rotarian DG Badrinath. Welcome to you, sir.
Thank you very much.
Rotarian DG Badrinath is known to have done extensive work in the area of kidney care and dialysis. The best way to understand that is probably to hear it from his own words. First of all, sir, how did this area come into focus for you?
Yeah, fine. Namaskara. Before I start anything, I just want to say something because it's concerned with Rotary and NGOs. See, Rotary, I feel now the clubs need to think of projects which can give huge impact on mega scale rather than mini scale. Our clubs need to look at big projects. I can cite them. One of our projects in our 3192, which is that Mega Jaipur Food Camp, which we are doing, 26 years, and we have touched more than 55,000 beneficiaries, provided prosthetics. It's a mega camp. Similarly, one we are going to talk about now. Coming back to your question, Sanjay. Suresh Kumar, who was the ex-minister and MLA, is a good friend of mine. They get a fund. Every MLA or MP gets a fund which they use otherwise. This person said, why not we use on a cause which benefits the community? He asked me what to do. Somehow, incidentally, I was looking at the statistics of the kidney failures in Karnataka. You will be amazed to know 6.3% of rural population, which is almost 800 per million, are affected by chronic kidney disease. We call it a CKD. And about 20% of that converts to ESRD, which is kidney failure, where you need a dialysis or a transplant. It's a huge number. And more pathetic is not even 30 or 35% get treatment. Others go to the logical end. That made us think, why not start a dialysis center?
So that's how it all began. Yes. So even the government can actually help initiate such projects, and I think that's another great tip for our Rotary leaders. Like, what are some of these projects? How do you identify them? And you are very right, we definitely need to scale this up.
Yes.
So I think this is a good starting point. So sir, do share with all of us the different types of work that you have done in this area.
Yes, thank you. It's almost 10 plus years now, our Pandit Deendayal Upadhyaya Dialysis Center. We run only 2 shifts. It's a daycare center and done 52,000 plus dialysis, of which 40% is absolutely free. We don't charge a single rupee for a BPL patient. And we charge a nominal of just 500 for others. In Rotary's words, to tell you, as per the market price, we have done something less than 12 to 13 crores worth dialysis at these costs. Apart from that, we also help the poor in blood transfusion. We do it ourselves, otherwise they need to go to nursing homes, get it done. And also training of dialysis technicians. Dialysis technicians are scarce in Karnataka. So what we do is, we go to the colleges which offer this dialysis technician course. It is a 3-year course. We get about 6 of them for 6 months training in our center. We train them up, and after 6 months they are absorbed. Otherwise, they just are confined to the diagram of a dialysis machine. That's it. This is one area where our dialysis center is focusing on. Now, to answer your question, what other things? Doing just dialysis, we've thought, is no big issue. We should stop people coming into dialysis.
Oh, that's wonderful.
Yes. So we thought of starting a diabetes center, since diabetes is one of the major cause for kidney failures. See, imagine just like, whether it is heart or any other problem, you can get an angioplasty or an open heart surgery done, and with good medication, life can be through. But for a poor person who has got a kidney failure, he has to be on dialysis thrice a week for the rest of his life, which is horrible. Otherwise, he needs to go for a transplant, which costs anywhere between 10 to 12 lakhs in a hospital. How can a poor afford? So we thought, let us try and aim at this diabetes center. So we are starting a diabetes center. Almost everything is set up in a matter of 1 or 2 months above our dialysis center. The intention is create awareness. At this point, I would like to tell you another statistic which is very alarming. As far as 2023 is concerned, if I am right, 104 million are diabetic in the country.
That's a huge number.
It's a huge number. And more alarming is 140 million are pre-diabetic. So chances of them going to the diabetic stage, if we do not treat them, is very high. That made us think to start a diabetes center.
Amazing. I think the need for that is, of course, very well explained by you, and I think if those are the numbers, it makes really good sense to put in that. But I've heard more. You've done a lot more in this world.
Yes.
So let's hear it from you.
So nice of you. As you know, see, diabetes causes many problems, many side effects. One of them is kidney. So we stop people coming to diabetes to whatever extent possible. It affects heart, ophthalmology, neuro, in most of the cases. We thought that, okay, identify people, create awareness, you engage the other Rotary clubs throughout the country, throughout the world. See, we need to, I personally feel that Rotary has to take this diabetes program in a huge way, perhaps more than how polio we did it. Because the occurrence of polio is very limited, even though it's being minimized now, but world says that India is the capital of diabetes. So we need to address it in a huge scale. I call upon the leaders of Rotary, wherever they are, to seriously think of this diabetes program where we can ultimately cut down on people coming to dialysis also. Now, controlling diabetes, identifying them. See, rural population is one which is most affected. A small survey we did. So we are starting a rural diabetes program. It's a wonderful idea where we need the support of many clubs. We are going to have 1 or 2 vans which will go to the villages initially in and around Bangalore. On an average, there are 9 holidays in a month and there are 12 months. So 108 villages we will be covering. And each village, is associated with the neighboring villages. So all the, let us say in one place, we go to village A1, other 11 villages come there for that month. So like the 12 months, each village has a population nothing less than about 800 to 1000 on an average. So almost a lakh of people we will be monitoring every month.
For 12 months. Or for long?
Throughout, long. Our people will go there and monitor, and we will have a wonderful statistics of their family, any other problems, and anybody having these problems, they can come to our center and we give them free treatment.
Absolutely.
Or at a very low cost. So it's a holistic approach. We are also thinking of alternate therapy and alternate medicine too. We did a small camp with Vivekananda Institute, where they showed some of the yogic exercises, and we were surprised and also happy to know that their diabetes counts came down by almost 30 counts.
Wow.
Just by doing diabetes, the yogic exercises, the diabetes came down. So we want to have many other types of alternate therapies. See, most of we call ourselves educated, but unfortunately, we do not go to the right doctor. We go to our family doctor, show the blood report and get some medicines. We need to go to an endocrinologist or a dietitian only, because they will be immersed in this field. We are also going to have a nutritionist. We are also going to have a counselor, so that a holistic treatment will be given everywhere.
Fantastic. In fact, that is why I said it's best to hear from you, because the variety, the way of thinking, the way you think holistically, you may have started with one but then built on and brought in specialists, kept you an open mind to looking at alternative therapies. I think we really encompass this entire thing. So those are some tips for our Rotary leaders. How can you scale this model that our own Rotarian DG Badrinath has done? And I'm sure he'll be more than happy to share how he worked on it, even in more detail, one-on-one with you. So do reach out to him if you wish to support this cause and scale. Thank you very much indeed, and thank you, Dr. Professor. I should call you doctor, I should call you professor. I think you built yourself that way, but really, really humbled to hear how beautifully you've taken on this. Thank you so much.
Thank you.